Thanks, Mark, for that kind introduction. As I was sitting here listening to Ivor's talk, it was really interesting, and I was trying to think about, well, what is the connection between the research that he's doing and what we're trying to do here in D2V, data science to patient value. And I think, as this research expands more broadly in terms of testing in the clinical arena, it would really have a direct impact on what we're interested as well, which is looking at both the outcomes of patients as well as the cost. So going forward, will that new technology improve patient outcomes, and can it reduce costs for patients and hospitals going forward? So thank you for the opportunity to come present on behalf of the other PIs of the data science to patient value, Michael Kahn, Gene Kuttner, and Lisa Schilling. So just as a reminder, we were one of the groups who were lucky to be funded by the Dean's Transformational Grant Funding. And the purpose of that funding was to really provide innovative scholarship that makes a significant contribution to both knowledge and science on the CU campus as well as nationally. Part of it was to have multidisciplinary collaboration, faculty teamwork across different career stages, as well as bringing national leaders to CU. And then it was also supposed to provide a training opportunity in interdisciplinary research and multidisciplinary research on campus. So some of you may or may not know D2V, which is our current name, was a combination of two different grants. One was called Pivot, which was focused on trying to think about how can we deliver high-value care in terms of both improving outcomes and reducing costs, and then a data science component to it. So how can we really think about the science of data as well as use that data to improve patient care? So we were funded together, and now we're called D2V. And as part of that, we've come together to kind of formulate a joint vision statement, which is to make the University of Colorado School of Medicine a national and global leader in the development, implementation, and dissemination of person-centered, high-value healthcare by advancing innovations in data and health system science to improve the lives of patients, families, and communities. So how are we going to do this? So our objectives are to accelerate rigorous, cutting-edge data science methods and applications to address pressing health problems. Our second objective is to advance the science of person-centered, high-value healthcare across the care continuum and really integrating the different perspectives, including patients, the health system, and providers. And then a big component of that is really to train the next generation of scientists who can both integrate the data science component and then the health systems innovation. So we think the three unique features of D2V are really this multidisciplinary group of collaborators that span the data piece to the healthcare delivery piece and everything in between. The second component is really the incorporating the multi-stakeholders that are critical to the delivery of healthcare. So that includes, patients, caregivers, providers, the health systems, payers, and policymakers. And then really the last thing is this collaboration between researchers and the health system. I think for us to be able to take what we do in research and to improve healthcare, we need to engage stakeholders in the health system because they will be able to help integrate that into care and help leverage that. So this is the organizational structure of D2V. So we have the executive committee, which is comprised of the 4 PIs, and Kelly Burns, who's the program manager. And then we have 6 cores, which I will go into a little more detail on each of them. So we have a patient and system value core, a stakeholder engagement governance core, a data and informatics, analytics, dissemination and academic industry collaboration, and then a training and education core. And then beyond that, we have an internal advisory stakeholder group, which is comprised of people from the health system as well as other research programs on campus, and then the broader community. So in terms of the data informatics core, I mean, one of the challenges that we're trying to tackle is how to bring, all these different data sources together and to put it together so that it's analyzable, so that we can provide this data for researchers to make novel observations, as well as provide data that then they could use for additional research grant funding. So the data and informatics core is led by Michael Kahn, David Kao, and Tom Maddox. And really their charge is to provide expertise and tools in data management and data curation, data discovery, integrating the different sources of data. I mean, right now, these days, patients, everybody has these Fitbits, and so it's generating a lot of data. And is there a way we can think about incorporating that data into routine clinical care, as well as, use that care to predict maybe if patients will develop condition X, Y, Z. Important to that is really working with other entities on campus, such as Health Data Compass and the CCTSI, to collaborate on different tasks or services, but as well as to provide a unique service that D2V can provide to researchers across campus. As part of this, we're also thinking about recruitment, and so we've identified specific skill sets that we will be looking to recruit researchers with emphasis in natural language processing, visual analytics, distributed computing, data harmonization, data programming, and others. And so over the next couple years, we'll be bringing researchers with that expertise to campus. The next core is analytics, and that's led by Tel Bennett and Debashis Ghosh. And it's a group of researchers who are interested in innovative applications of complex analytic approaches and developing novel analytic and computational approaches, methods, and tools. And so their recruiting emphasis is really on researchers who are interested in predictive modeling, machine learning, and then we're in the process of recruiting technical staff who can use different statistical programs to help with leveraging the data resources that we will be developing. The third core is the Patient and Systems Value Core. This is a core that's led by Dan Matlock and Mark Greitz. And what they're really interested is thinking about the science of healthcare value. I mean, the usual definition for value is outcomes over costs, but that the outcomes and costs may be different depending on who you're talking to. I mean, patients may value a different outcome than what providers or the health systems may value, and it's really that core will be charged with how to integrate all of those different perspectives as we move forward. So it's really integrating the patient's perspective and then thinking about economic evaluations so that we can provide really actionable data to our stakeholders like providers or the health system so that they can make policy changes. And in terms of their recruitment emphasis, they're thinking about recruiting researchers in systems engineering and organizational management. The fourth core is the Stakeholder Engagement and Governance Core, and this is led by Matt Winia and Heidi Wald. And what they're interested in doing is really advancing the science of deliberative stakeholder engagement in healthcare. And that's really a concept about trying to involve everyone in decision-making, and those decisions are more likely to be accepted by everyone involved when there's collaboration across all of those who are involved. And what this core will do is really to provide technical assistance to researchers, leaders, and organizational partners who are interested in engaging stakeholders. And the process of doing that, they will be providing a resource library of what engagement activities are occurring on campus and how to go about the process of engaging stakeholders. They will be further advancing the science and then doing some training as well. The fifth core is dissemination and academic industry collaboration. This is a core led by Bethany Kwan, and their really goal is to engage, really disseminate the work of D2V investigators, but also engage external stakeholders so that the work that D2V produces leads to greater scientific impact and sustainability over time. So they will be looking to work with collaborators both within the CU campus as well as outside, create academic industry partnerships, and then really promote the activities that are being done through D2V. And finally, a big part of the mission of D2V is the training and education. And our goal is to train and mentor the next generation of scientists who really can bridge the gap between the data and the health systems innovation component. And we, as of Wednesday, we released an RFA for our fellowship program where we will be training 2 fellows each year for the next couple years. And so the fellowship will begin in July of 2017. And then as part of this, as I alluded to earlier, recruitment is a big component of this. And so over the next couple years, we'll be bringing lecturers and researchers from across the country to present and bring new ideas to the campus. Today, we've had 2 speakers who've come to campus, and you could see the topic that they spoke on. And then in April, we'll have Paul Razul, who's the professor and chair of biostatistics from the University of Wisconsin, to come to the campus, talk about his research, as well as help us think about how we could recruit and advance the depth that we have on campus as far as biostatistics. And then the last program that we have going on is the D2V pilot grant program. So the RFA was released 3 or 4 weeks ago, where we're taking new ideas from investigators about how to really think about both data and healthcare innovation. So we will be funding up to 6 projects each year for the next couple years, so that if you have any new ideas, this would be a great venue to and a funding opportunity for those who are interested. And then with that, I'll stop and take any questions. Yeah, I mean, I think we will need some more infrastructure, and the hope is that really as we start to think, as you start to think about those projects, we can engage the hospital and the health system to say, well, is this something of interest, so that both D2V can help with providing additional funding to think about how to integrate those tools into clinic. So I think there is a need, but the challenge is really trying to work with the hospital to have them think this is of added value, for our patients. This is of added value to the health system, so that everyone's engaged in that process. Yeah, I think so. I mean, we've started talking with the hospital about thinking about developing a platform for shared decision-making, just as an initial start. But is there a way we can develop the analytics and the computing platform to say, well, this is the platform we could do shared decision making, and then investigators can come and develop the different tools that they would need for their specific area, and then we can then implement it in real time in the clinics. So we're just starting that discussion, but obviously it would take, both, a lot of buy-in from the hospital, as well as, the investigators' expertise to move that forward. Well, I think D2V has the opportunity to study it, right, and to understand the potential impact of changing healthcare policy, to understand what hospitals are doing. For example, in one of our pilot projects that's led, so Rich Lindruth and Marcelo Perron have a R01 looking at kind of what hospitals are doing in response to changing reimbursement. And so D2V has funded a pilot project for them to go to hospitals to understand, well, in response to those changing policies, what are they doing so that we can identify best practices and then bring it back to our health system. And so I think we have the opportunity to learn from these changing reimbursements and different policy issues that are coming up.
Healthcare system expands, buys up hospitals, and builds clinics. As they expand, the other part of that is, have you reached out or are you planning to?
Yeah, no, those are great questions. And I think our goal is really to engage the hospital more in research, and we've started those early discussions. So I think our hope is to, over time, engage them in opportunities and think of these new hospitals as venues for research. So that's based, the new hospital systems are like our lab. So we can think about different interventions to test whatever researchers are interested in, as well as far as other hospital systems. We haven't, just because I think part of the initial funding was to focus research on the UC campus, so we haven't really started to think about expanding beyond that. Although one of our projects is focused on identifying high-risk asthma patients, and that project is starting out at Denver Health currently.
It just seems, I understand the hospital funded this, so they want.
Yeah, no, I think that's definitely true, and that would be our hope is, if we can demonstrate effectiveness or efficacy in one hospital system, then can we replicate it outside of the one system? Great, thank you.